A St. Louis doctor is looking into cancer rates across the region, trying to figure out why he's seeing more younger patients.
Fox News' Mallory Thomas tells us how a new early detection cancer screening could help.
Meet Dre Bergeson, a loving wife to Daryl and a mother to their 8-year-old son, Finn.
She was kind, compassionate, loving, always thinking about everybody else but herself, even through the diagnosis.
Dre began having heartburn and pain in August of last year. She had a CT scan in September.
There was a large mass on her kidney. After that, she had surgery, kidney spleen removed in October. At the end of October, she thought everything was gone.
Just 2 weeks after Dre turned 37, and right before Christmas, life turned upside down.
Chromophobe renal cell carcinoma. Never thought I would know that. It was aggressive and it just didn't stop. That was after our doctor looked at it and figured it out and was like, there's no way you should have this cancer right here. And then he asked us, if we were ever around any nuclear waste, and she just was like, oh yeah, Francis Howell.
This young mother and wife lost her battle to cancer on April 15th. These pictures are from her send-off at the home that she and Daryl spent 2 years building together. A home Dre got to live in for just 6 months.
There was a little bit of a trend in terms of patients that I saw that were coming from specific areas of St. Louis.
Dr. Gautam Agarwal was Dre's doctor. He's a urologic oncologist with Mercy. He's seen a trend in rare cancer cases.
These patients were younger and were being diagnosed with sometimes more aggressive and more rare types of tumors, and they happened to be coming from Coldwater Creek or Weldon Springs. And I noticed this trend was occurring.
The trend led Dr. Agarwal to become the director of precision medicine,
with the main goal of catching disease earlier, and that's utilizing early cancer detection tests, using genomics, using artificial intelligence to look at our populations to say who may be at the highest risk of developing a cancer.
It sounds futuristic, a multi-cancer early detection screening with just one blood sample, but it's changing lives.
We've done thousands of tests so far and have changed the lives of about 10 to 20 people who were caught with that test.
Dr. Agarwal says the test screens for more than 50 types of cancer.
It's really disheartening when you get a patient that has a cancer that's found much later than it should. We know that when you catch a cancer early, before it even forms sometimes, precancerous, and then sometimes in that stage 1, really early cancer, it's a cure, essentially.
Daryl wonders if the multi-cancer early detection screening could have given him more time with Dre.
She didn't deserve to die. That's really what it boils down to, and I want people to know about this situation here. It's just hard. She was my best friend.
We reached out to the Francis Howell School District to see if they do separate testing from the federal government. They tell us in a statement, several years ago, the district utilized a third party to conduct environmental testing. Test results met regulatory environmental standards, and additional testing has not been conducted since. Mallory Thomas, Fox 2 News.